Did you know that 1 in 8 people worldwide are living with obesity? When paired with diabetes, another global health crisis, the stakes are ever higher. These two conditions are deeply connected, each influencing the other in a way that demands a smarter and more holistic approach to care. So, in today's session, we dive into the critical conversation around diabetes and weight management, a topic that affects millions yet it's often misunderstood. So, we are honored to be joined by Dr. Apurva Parekh, who will be sharing his insights and expert views, practical strategies, and fresh perspective on managing both these conditions more effectively. Dr. Apurva Parekh is a distinguished consultant diabetologist from Kolkata who extensive experience in diabetes care has helped countless patients achieve better health outcome. Known for his compassionate approach and up-to-date knowledge on the latest advance, Dr. Parekh specializes in the complex link between diabetes and weight management. His expert guidance promises to shed light on the effective strategies to tackle these interconnected challenges with confidence and clarity. So, before moving further, Doctor, would you like to add something from your end?
Yes, I think this is a very burning issue these days, diabetes with overweight or obesity, and how do we reduce both the risks of diabetes mellitus and as well as overweight and obesity. So, how to tackle these issues with these days it has become very imperative because the number of diabetics in India as well as over entire world, the number is increasing exponentially. So one needs to really look into these matters and how to control diabetes, and at the same time to keep your BMI within range is very important.
Thank you, doctor. So, with this, we will start with our conversation. Doctor, my first question to you is why it is harder for people with diabetes to lose weight compared to others?
It is multifactorial. Sometimes basically diabetes because of insulin resistance and lack of insulin sensitivity, people do get to put on weight. And at the same time, if you are stuck with the wrong kind of food, or if your diet is not according to what is prescribed, at the same time if you're leading a sedentary life, I think these are all factors which can lead to poor control of diabetes, and at the same time weight management will also not be possible.
Okay. So, doctor, can losing weight actually help to reverse or improve diabetes?
Definitely, because if anybody strives to reduce 5 to 10% of existing body weight, there will be definitely a change in overall time in range glucose, and at the same time, all the parameters like fasting, PP, and HbA1c will be well under control if person strives to lose anything between 5 to 10% of body weight.
Okay. So, doctor, my next question is how much weight does an individual need to lose to see a difference between their blood sugar levels?
As I already said, somebody whose body weight is say about 80 kgs, and if he strives to lose about 10% of his existing body weight, that also will give him a very good control, diabetes control. At the same time, uh, if he increases his physical activity, and at the same time if a proper diet control is there, all these factors put together will take care of his diabetes management.
So, doctor, since we are talking about food, so are there any certain foods that help with both weight loss and blood sugar control?
I think if a person includes more of fibers and protein in his diet and cuts out on carbs and fat, then definitely it can give rise to good glycemic control. Because if you include food with low glycemic index in your daily diet, I think that also gives a very good result.
Okay. So, are weight loss diet like keto diet or intermittent fasting are safe for people who are diagnosed with diabetes?
I think one needs to be very careful with all these kind of diets, because a person who is on, say, oral hypoglycemic agents or insulin, and if goes on a crash diet, there are always possibilities of having recurrent hypoglycemias, and at the same time, the sugar levels will also wildly fluctuate. So one can really go from hypo to hyperglycemia. And in that scenario, I think one needs to have a balanced diet, but at the same time, if good glycemic control needs to be achieved, one should uh, also include lifestyle modifications like diet, and at the same time, regular physical exercises.
Okay. So, doctor, if we come to the point of medication, the medicine, so can diabetes medication make it harder to lose weight?
Sometimes the drugs like sulfonylurea or glitazones or insulin, all this can lead to weight gain. So, in that scenario, one needs to adjust the dosage of all these medications, or sometimes switch over to newer molecules like SGLT2 inhibitors or GLP-1 agonists and GIP agonists.
Okay, thank you so much, doctor, for that information. So, my next question is it possible to gain weight in a healthy way if someone has type 1 diabetes and is underweight?
In these most of these kind of patients who are type 1 diabetic and underweight, they are usually on insulin. So insulin will definitely give rise to a little bit of weight gain, and at the same time, people who are on insulin, sometimes the diet also becomes little irregular, and people tend to eat more and put on weight. So in that scenario, one can definitely gain weight with type 1 diabetes.
Okay, so in the same case, like if someone is with diabetes and is already at a healthy weight, so do they still need to worry about what they eat?
Yeah, I think it also becomes very important if your weight is within range, and at the same time, if you have a good glycemic control. But looking at the, I mean, like number of years a person is going to live despite of all these problems, one has to be very consistent with his medication, with his diet, with his physical exercise. So all these needs to be taken care of so that he maintains with his good glycemic control, and at the same time, proper body weight also.
Okay. So, doctor, lastly, do you have any message or tips for our audience on these both conditions?
I think one should regularly visit their doctors and at this physicians rather, and at the same time regular follow up along with regular examination of like blood reports, the annual eye checkup for retina, and at the same time the adjustment of diabetic medications is also very important to keep diabetes under check. And uh, obviously lifestyle also plays a very big role. Regular physical exercises, that means 150 minutes of regular exercise per week is needed. At the same time, the diet should also be good enough to take care of fibers, nutrients, proteins, minerals, everything. It should be a very balanced diet. In a diabetic, one should not try to fast or feast in that scenario. And these are these are the factors which will, on the long run, help in controlling diabetes as well as weight.
Thank you so much, doctor. So, as we wrap up today's session on diabetes and weight management, a heartfelt thank to Dr. Apurva for offering such a practical and relatable, also empowering insights. Managing diabetes is a lifelong journey, and Dr. Apurva's guidance on the role of weight, lifestyle habits, what are lifestyle modifications need to be done, and also long term commitments has shed light on how small and constant changes can lead to significant health improvement. To all our viewers, thank you for being a part of this important conversation. Remember, weight management isn't about strict rules or quick fix. It's about building a sustainable habits that supports your blood sugar, also your energy and overall well-being. So stay connected with us for more expert-led health sessions. Until next time, take care of your health, stay informed, and follow us on social media for more updates, tips, and upcoming events. Thank you so much, Dr. Apurva Parekh, for joining with us and sharing your knowledge.
Thank you so much. Thank you so much. Good night.